In a world that screams for your attention, there's a place that invites you to peace. You don't need a building. You don't need a choir. You just need to turn your heart to Air One.
Air One. Songs that heal. Lyrics that pray for you when you don't have the words.
From Lauren Daigle to Elevation Worship and more.
This isn't just radio. It's worship for the everyday.
Escape the noise and worship now.
Download the Air One app. Ask your smart speaker to play Air One or visit air1.com. Air One. Worship now.
This is Medicare Moments with your host, Toni King. Hi, Toni King.
How are you doing, Jim? What's going on?
Medicare Moments. What health network does Medicare use, Toni, is the topic of today's Medicare Moments podcast with Toni King. And Toni, this comes to us from Knoxville, Tennessee. And the question is, hi, Toni. In September, I turned 65. I'm on COBRA from my job, which I retired from in May when I had heart surgery. The cardiologist informed me last week that the only thing that will improve my health is a heart transplant. I need your guidance, Toni, because I do not know what to do about enrolling in Medicare. Should I enroll in Medicare's network with a Medicare supplement, or go with a Medicare Advantage plan, or stay with my current COBRA plan until it ends in about 16 months? Please help me because I'm overwhelmed with the confusing mail and marketing I'm receiving since it's my time to enroll in Medicare. Thanks, Jay from Knoxville, Tennessee.
Isn't that amazing? And people need to realize that there are 10,000 people turning 65 every day. That's one person getting on Medicare every 8 seconds a day for the next 10 years. I mean, we have a lot of people. That was before the birth control pill was ever invented.
Good observation.
I realize that.
Good observation.
Good observation. I mean, those days now we're down to having 2 kids. Our parents had 6, so there's a lot of people that are getting on Medicare. And I don't know how they find your phone number, but all of a sudden when you're turning 65, 6 months prior, the lists are sold and people start calling you. So you need to be aware. And one thing I can tell Jay, and Jay's who wrote this from Knoxville, Tennessee, that anyone who is turning 65 or past 65 and enrolling in Medicare for the first time, guess what? There's no network. Medicare does not have a network. It's like how old-fashioned insurance used to be. It's true benefits.
So you don't have to worry about finding a network provider or facility since you're leaving your employers and your employer's COBRA plan with that plan's network, right? You don't have to worry about that because
and
Medicare
is concerned because he's now got heart issues and he's going to have a heart transplant. That's going to be something that's very serious that he's going to have.
Well, but this focuses, Toni, on what you say about everyone has a different situation in their life. His situation is very different, probably than most of his friends.
I would say. I mean, not very many of them are going to have been told they need to have a heart transplant. And because he's not working full time with True Company Insurance, he needs to enroll in Medicare. And what he needs to do is sit down with his doctor. I'm sure his doctor is going to bill Medicare. You want to make sure your doctor is billing Medicare. And how hard is that? I mean, most doctors, MD Anderson, St. Luke's, Methodist Hospital, most of the facilities will bill Medicare. They like original Medicare because you and your healthcare professional are in charge of your healthcare. That's what you need to know. Okay.
That's important. And that's original Medicare. And you're listening to Medicare Moments with Toni King. The question today, what health network does Medicare use? And we'll be back with more right after this.
Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Zinnia offers research-backed videos intentionally created for people with dementia, engaging, calming, and easy to follow. Whether you need to ease agitation, create moments of joy, or make daily routines smoother, Zinnia is here to help. Family and professional caregivers use our content to turn challenges into opportunities for connection. Accessible by subscription on mobile devices and connected TVs, Zinnia is simple to use whenever you need it. Because when caregiving feels easier, life feels better. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
Welcome back to Medicare Moments. Toni King is your host, and today we're talking about, is there a health network for Medicare? Toni?
Is there a health network for Medicare? I said, no, there is not a health network for Medicare.
I was listening and I just wanted to have fun with you.
No, there's not a health network. It's the best network you got because you and your doctor are in control. I had someone who had enrolled in a Medicare Advantage plan. The gentleman who wrote this article asked, should you go with an Advantage plan? Well, last week I had a phone call from a daughter who's just flipping out because her dad is diagnosed with pancreatic cancer and he really needs to go with original Medicare. He's on a Medicare Advantage plan, HMO. He's been on one for years. And now he wants to go back to original Medicare because he needs the serious health situations taken care of. And he has to wait until Medicare's annual enrollment period, which is from October 15th through December 7th, to make a change back to original Medicare. But what's he going to use to pick up what Medicare doesn't pay for? Now he has to answer health questions. Right. Once a person has been on Part B for longer than 6 months, after that, if you go and get a Medicare supplement, you do not have to answer health questions. What I would say to Jay, since he has a serious health issue and he's turning 65 in September, is that he should enroll in original Medicare, Part A and Part B, and get a Medicare supplement because it will start immediately. He does not have to answer one health question. And like I said, him and his doctor are going to be in charge. The transplant facility will be in charge of his health care.
And he's in the window when you don't have to answer health questions. And then he also will need a prescription plan with that, right, Toni?
Right. And we would look at what prescription plan is best for him. He's turning 65 in September. Next year is a different situation as far as prescription drugs. Around October 1st through October 15th, we want to look at what plan is going to be best for him for next year, because he's going to have some transplant drugs and there's no telling what his prescriptions are going to be. So he's going to have to take the time for it.
So when you go through the annual enrollment period and you make your choice, that choice takes effect when you make the change or the first of the upcoming new year?
It takes effect January 1st.
January 1st of the new year. Okay.
Correct.
That's important to know.
So he would have 2 prescription drug plans, one September, October, November, December, and then he would change for January 1st because he's going to have some serious prescription drugs. Transplants are not easy. So he will have some serious prescription drugs.
You do.
Yeah.
You do have serious prescription drugs with that. And now he also has Cobra. So Cobra's been put in the mix. So he'll be riding that out through the end of this year, or the end of the calendar year.
I would advise him to go ahead and cancel his Cobra for a September 1st effective date. There's no reason for him to keep Cobra. Okay. Cobra and Medicare supplements are not going to pay together. Okay.
And it's fair and accurate to say that Cobra can be very expensive.
Oh, definitely. Definitely. I have some people come in, they're paying between $1,500 to $2,500 a month for the company Cobra. Even though he's got a 16-month window for his Cobra, I wouldn't wait past what they call the Medigap open enrollment period, which is when you first get Part B, you have that 6-month window that you can get your Medicare supplement without having to answer one health question. And he would go with a Plan G and his out-of-pockets, whatever his Part B deductible is. This year, it's $240. He's going to get the best health care, and his out-of-pocket's $240. You cannot beat that.
You cannot beat that. That's right, Toni. Original Medicare and doing that. And it gives him the freedom that he needs to get the care that he needs in the place where he needs. And that's a great tip from Toni King.
And what's important is he gets to pick and his doctor gets to pick where he goes, not an insurance company. And readers need to always, I advise them to talk to their healthcare professionals when they've got a specific health situation. You want to make sure you get the best choice for yourself. That's what you want. Go with original Medicare, with a Medicare supplement, or is it best to go with the Advantage plan? You want to look at everything.
Well, we know this gives you lots of questions. You may have other ones concerning Medicare, and you're welcome to call Toni's Medicare Hotline for America, 832-519-8664. Any time of the day or night. You might wake up in the middle of the night and say, I have a question for Toni King. 832-519-8664 is the number to call. Leave a message and someone will get back to you. Right, Toni?
That's right. But I can't exactly say I'm going to answer the phone at midnight.
Understood. And reasonable.
But we will get back with you within a reasonable amount of time to help you with your question. I had a gentleman who put Neil Armstrong on the moon. And you've heard this before, and he had Medicare issues. He couldn't figure it out. He was a rocket scientist. If you can put a gentleman on the moon, but you can't figure out Medicare, something's wrong. They're making this too complicated. People with Medicare can't figure it out. People that work for Medicare.
Sometimes government programs can be like that. So Toni welcomes your questions. She's also written a book. She puts everything into plain English language to try to make it as easy as possible. It's the Medicare Survival Guide Advanced Edition, and it's available at her website, tonisays.com, TONISAYS.com. Send her a question, info@tonisays.com, and she'll probably answer it in an upcoming Medicare Moments podcast. So Toni, anything else you have to say to our listeners?
No, I just say take your time and personalize your Medicare and make it meet your needs, not the insurance company's needs and not the plan's needs. Make sure you make it meet what's best for you and your doctor. Wouldn't you say? So thanks, Jim. I appreciate your time today. And I will talk to you later. Okay? See ya.
Hi, everyone. This is Meredith from the Senior Fitness with Meredith podcast, where I discuss all things for seniors. From fitness, your health and wellness journeys, how to be all over strong and beyond. I also have my mini podcast called Motivation with Meredith. It's a great, quick motivational pick-me-up for your days. Join me, listen now, search for Senior Fitness with Meredith on your favorite podcast platform.